Most people think Medicare works like a light switch. You turn 65, you flip it on, and suddenly you're covered. Done. But Medicare is not a light switch. It's more like a maze with deadlines hidden around corners, fine print tucked behind every door, and penalties that can follow you for the rest of your life. Nobody hands you a map when you turn 65. They just wish you happy birthday, send a few confusing letters, and let you wander in. And that's where retirees get hurt. Not because they're careless, not because they're bad with money, but because Medicare has rules that sound small in the moment and become very expensive later. A missed deadline, a plan chosen too quickly, a letter tossed in the recycling, a supplement window that quietly closes. One wrong turn can cost hundreds, another can cost thousands, and a few can cost you for life. So in this video, we're going through 6 of the most expensive Medicare mistakes retirees make and what to do instead. Some of these mistakes are obvious once someone explains them. Some are buried so deep that even organized, careful people miss them. And one of them catches almost everybody because it happens quietly, year after year, while people think they're doing everything right. Before we get into the mistakes, you need to understand the basic Medicare setup. Medicare comes in pieces. Part A is hospital coverage. Part B is doctor visits and outpatient care. Part D is prescription drugs. Then there are 2 main roads people usually take. The first road is Original Medicare. That means Parts A and B directly through the government, often paired with a private Medigap supplement to cover the gaps. The second road is Medicare Advantage. That's an all-in-one plan run by a private insurance company, where hospital, doctor, and usually drug coverage are bundled together. Those 2 roads matter a lot, because several of the biggest Medicare mistakes happen right at that fork. Mistake number 1 is assuming Medicare is automatic. This surprises people every day. Medicare is not automatic for everyone. If you're already collecting Social Security when you turn 65, then yes, you usually get enrolled automatically. But more and more people delay Social Security so their benefit can grow. And if you're not collecting Social Security yet, nobody quietly signs you up in the background. Your 65th birthday starts the clock. And if you miss that clock, Medicare does not always forgive you. The main window is called your initial enrollment period. It lasts 7 months. The 3 months before the month you turn 65, the month you turn 65, and the 3 months after. That sounds generous, but many people miss it because they don't realize it applies to them. And once that window closes, 2 bad things can happen. First, you may have a gap in health coverage. Second, you may get hit with a late enrollment penalty. And the painful part is that this penalty is not a one-time slap on the wrist. For Part B, the penalty adds 10% to your monthly premium for every full year you were eligible but didn't sign up, and you usually pay that extra amount for the rest of your life. A person who waits 7 years does not just pay a little more for a few months. Their premium can become 70% higher forever. Using the 2026 numbers, that can turn a roughly $200 monthly premium into something closer to $345 a month. That is about $1,700 extra dollars a year, every year, for life. And prescription drug coverage has its own late penalty too. But there's a second trap inside this one. A lot of people keep working past 65 and assume their work insurance lets them delay Medicare safely. Sometimes that is true. If you're covered through your own current job or your spouse's current job and the employer is large enough, you may be able to delay without penalty. But not every kind of insurance counts. Think about Walt. Walt retired at 64 and kept his old job's insurance through Cobra. Cobra felt like real coverage because he still had an insurance card. He still had doctors, he still had claims getting processed. So when he turned 65, he assumed he could delay Medicare. But Cobra does not protect you from Medicare late penalties the way active large employer coverage can. Neither does retiree coverage, and neither does coverage from a small employer with fewer than 20 employees in many cases. By the time Walt realized the difference, he had walked straight into a coverage gap and a penalty that could stay with him for life. The fix is simple, but you have to do it before the deadline. Do not guess. As you approach 65, find out whether your current coverage actually lets you delay Medicare without penalty. Get the answer in writing if possible. If you are not completely sure, enrolling on time is usually the safer move, because you can make changes later. but you cannot go back in time and erase a lifelong penalty. Mistake number 2 is missing your one-time Medigap window. This one is quietly heartbreaking because it can close a door that almost never reopens. Remember the first road? Original Medicare? A lot of people like Original Medicare because it gives them broad access to doctors and hospitals. But it has one feature that shocks retirees. There is no yearly cap on what you can pay out of pocket. Part B generally covers 80% of approved outpatient costs. That leaves the other 20% on you. And that 20% does not stop just because the bill gets scary. One serious illness can turn that gap into a number that changes a family's finances. That is why many people who choose Original Medicare also buy a Medigap policy. Medigap is a private supplement plan that helps cover those gaps. It can make medical costs more predictable and protect you from a terrible year becoming a financial disaster. But the most important Medigap rule is not about the monthly premium. It is about timing. When you first turn 65 and enroll in Part B, a special 6-month clock begins. During that window, you can buy a Medigap policy without answering health questions. The insurance company cannot reject you because of your health. They cannot charge you more because you've had medical problems. For those 6 months, the door is open. But after that window closes, the rules can change completely in most states. Now, the insurance company may be allowed to look at your health history. They may ask medical questions. They may charge more. Or they may simply say no. Think about Eleanor. At 65, Eleanor felt great. She rarely went to the doctor. She looked at Medigap premiums and decided she didn't need to spend the money. So her 6-month window came and went. Nothing dramatic happened that day. No alarm sounded. No door slammed in her face. It just closed quietly. 3 years later, Eleanor had a heart procedure. Suddenly, a supplement sounded like a very good idea. But now the insurance companies could ask about her health. They saw her heart history and turned her down. Eleanor was not being punished for being careless. She was being punished for getting older and needing care, which is exactly the kind of thing insurance is supposed to protect against. Her cleanest shot was back at 65, when the answer had to be yes. The fix is to treat that 6-month Medigap window like one of the most important financial deadlines of retirement. Do not wait until your health changes to decide whether you want supplement protection. Make that decision while the door is open, because later, your health may get a vote. Mistake number 3 is falling for the $0 premium without understanding the trade-offs. This is where Medicare Advantage enters the story. Medicare Advantage is the second road. It is the all-in-one private plan. Many plans advertise a $0 monthly premium. They may also include extras Original Medicare usually does not cover, like dental, vision, hearing, gym memberships, or other benefits. On the surface, that can feel like a free upgrade. And for some healthy, budget-conscious retirees, Medicare Advantage genuinely works well. This is not a simple good versus bad story. It is a know-what-you're-signing story. Because a $0 premium does not mean zero cost. It means the cost shows up in other places. The first trade-off is the network. With many Advantage plans, you are generally limited to the plan's doctors, hospitals, and service area. A doctor you like may not be in the network. A hospital you trust may not be in the network. A specialist you want to see may be outside the plan. And outside the network, the bill can look very different. The second trade-off is prior authorization. That means the plan may require permission before it pays for certain care. A test, a procedure, a surgery, a rehab stay. When you are healthy, prior authorization feels like fine print. When you are sick, it can feel like a locked gate between you and the care your doctor recommended. The third trade-off is the way the bills arrive. With Original Medicare plus a supplement, you may pay a higher predictable premium each month. With Medicare Advantage, you may pay less upfront, but more as you use care. Copay here, copay there. A specialist visit, a hospital stay, a scan, a treatment. In a healthy year, those costs can stack up fast. In 2026, the yearly out-of-pocket limit for in-network care can be as high as about $9,200. That is not a small surprise. But the biggest trade-off is the one-way door. Think about Ray. Ray was healthy when he chose a zero-premium Advantage plan. For years, he felt smart. The monthly premium was low. He liked the extra benefits. He did not need much care. Then Ray received a serious diagnosis. Suddenly, he wanted to see a top specialist who was not in his plan's network. He wanted the flexibility of original Medicare. He could switch his medical coverage back. But there was a problem. Original Medicare alone still left him exposed to those unlimited out-of-pocket gaps. To protect himself, he needed a Medigap supplement. And now he was outside his original Medigap window. The insurance company could ask about his health. With his new diagnosis, they said no. Ray was not completely trapped in every possible way, but he had lost the easy path he thought would always be there. In many states, switching from Advantage to Original Medicare later is not the hard part. Getting the Medigap supplement after your health changes is the hard part. And the people who most want to switch later are often the people least likely to pass the health questions. The fix is to choose your road with both eyes open. Medicare Advantage can be the right choice for some people, but it can be harder to undo than it looks. If broad doctor access and supplement protection matter to you, the time to lock that in is at 65, not after your health changes. Mistake number 4 is setting it and forgetting it. This is the one that catches almost everybody. It does not care how organized you are. It does not care whether you picked the perfect plan years ago. The mistake is choosing a Medicare plan once and then never checking it again. That sounds harmless. It is not. Every year, Medicare drug plans and Medicare Advantage plans can change, and they do. The premium can change, the deductible can change, the doctor network can change, the list of covered drugs can change. That drug list is called the formulary. A medicine that was cheap this year can move to a more expensive tier next year. A drug that was covered this year can be dropped next year. A pharmacy that gave you the best price this year may not be preferred next year. None of this needs your permission, and if you do nothing, you usually roll into next year's version of the plan automatically. That means the plan can change while you stay still. Every year, your plan sends an annual notice of change. That letter explains what will be different next year. But it often looks like boring insurance mail. So many people leave it on the counter, bury it under coupons, or toss it straight into the recycling. That one habit can cost retirees a shocking amount of money. Think about Carol. Carol had 2 regular prescriptions and a drug plan she liked. The plan worked fine for years, so she stopped paying attention. Then one summer, the plan moved one of her drugs to a higher cost tier. It dropped the other from the covered list altogether. Carol did not read the notice. She found out in January at the pharmacy counter when the same medication she had taken for years suddenly cost a small fortune. Over the year, the extra cost added up to well over $1,000. And the worst part was that she did not have to pay it. Another plan in her own zip code covered both drugs at a much lower cost. The better option existed. She just never checked. That is why this mistake catches almost everyone. People treat Medicare like a crock pot. Set it once and forget it. But Medicare is the opposite. It rewards the person who checks. The fix is to reshop every fall. Between October 15th and December 7th, Medicare Open Enrollment gives you a chance to compare your options for the next year. Use Medicare's official plan finder on Medicare.gov. Enter your drugs. Enter your pharmacy. Compare the total yearly cost, not just the monthly premium. You can also call 1-800-Medicare. Even better, contact a free SHIP counselor. SHIP is a state program that gives unbiased Medicare help at no cost. No sales pitch, no commission. Just help. 30 minutes once a year can keep real money in your pocket. Mistake number 5 is walking into the income surcharge and never appealing it. This one usually affects retirees with higher income, but it can surprise people who do not think of themselves as rich. It can happen after a strong investment year. It can happen after selling a house. It can happen after a big retirement account withdrawal. It can happen during the last high-income year of your career. The surcharge is called IRMAA. That stands for Income-Related Monthly Adjustment Amount. But the simple version is this. If your income is above certain limits, Medicare adds an extra charge on top of your normal Part B and Part D premiums. In 2026, the first income line is $109,000 for a single person, or $218,000 for a married couple filing jointly. Go above the line, and the surcharge can kick in. And IRMAA has 2 nasty features. First, it works like a cliff. Going $1 over a threshold can push you into the next surcharge level. Second, It looks backward. Your Medicare premium today is usually based on your tax return from 2 years ago. That 2-year delay is where retirees get ambushed. Think about Frank. Frank retired at 66. When he started Medicare, he expected his premiums to match his new retirement income. But instead, he got hit with a big surcharge. He was furious. His paycheck was gone. His income had dropped. His retirement budget was modest. But Medicare was not looking at his current life. It was looking at his tax return from 2 years earlier. Back then, Frank was still working. It was his final big earning year. He had also sold a property. On paper, Frank looked wealthy. Today, he was not living that way. But the surcharge did not know the difference. Here is the part many people miss. You may be able to appeal if your income dropped because of a life-changing event. Social Security may recalculate your surcharge. Retirement can count. Marriage can count. The death of a spouse can count. Loss of pension income can count. The form is called SSA 44. Frank filed it. He showed that his income had fallen, and the surcharge was removed. Most people never do that. They just complain, assume the bill is final, and keep paying. The fix is to plan your income with Medicare in mind. Large IRA withdrawals, Roth conversions, property sales, and investment gains can affect your premiums 2 years later. And if an ARMA A surcharge appears after your income has dropped, do not just accept it. Check whether you qualify for an appeal. That one form can save real money. Before we get to the last mistake, quick note. A lot of what we just talked about comes down to protecting your retirement money from surprises. Taxes, penalties, premiums, deadlines, and rules most people don't see coming until it's too late. And that's also why some retirees look at physical gold as one way to diversify part of their retirement savings, outside the usual paper assets, like stocks, bonds, and mutual funds. So if you've ever wondered how a gold IRA actually works, I'll leave a link below to a free gold IRA guide in the description box below this video. Just click the link and enter your details, and the guide will be delivered directly to your email. It explains the basics in plain English, so you will understand how gold IRAs work, what the rollover process can look like, storage rules, fees to ask about, and the questions you should understand before moving any retirement money. You don't have to buy anything, just use it as a free educational guide, so you can decide whether physical gold belongs anywhere in your retirement plan. Mistake number 6 is assuming Medicare covers everything. This may be the most expensive surprise of all. People spend their working lives hearing that Medicare is health coverage for retirees, so when they finally get Medicare, they assume the big risks are handled. But the single biggest cost of later life is often not covered. Medicare does not cover long-term custodial care. That sentence matters. Long-term care means ongoing help with basic daily activities: bathing, dressing, eating, getting around, using the bathroom, supervision for memory problems, help at home, care in assisted living, care in a nursing home. Medicare may cover a short limited stay in a skilled nursing facility after a qualifying hospital stay, but it does not pay for months or years of custodial care. And that is the kind of care many families actually end up needing. Medicare also usually does not cover routine dental care, regular eye exams and glasses, or hearing aids, the exact things older bodies often need more of. And the numbers are not small. They can be devastating. Someone turning 65 today may face well over $100,000 in future long-term care costs. A single year in a nursing home can run past $100,000 by itself. Think about the Hale family. Their mother had been on Medicare for years. When she went to the hospital, Medicare helped. When she saw doctors, Medicare helped again. Then the first bill arrived. Then the second. Then the third. Month after month, the cost drained a lifetime of savings. Not because anyone did something wrong, but because the one expense large enough to wipe out the family was the one expense Medicare was never designed to pay. The fix is to plan for this gap before you need care. That could mean looking into long-term care insurance. It could mean considering hybrid policies that combine life insurance with long-term care benefits. It could mean setting aside a specific chunk of savings for future care. It could mean learning how Medicaid works if savings eventually run out. It could mean buying separate dental, vision, or hearing coverage. The worst plan is the one most people have by default. Assume it is covered, wait until the bill arrives, then scramble. Now put all 6 mistakes together, and they become a simple checklist. 1. Do not assume Medicare is automatic. Know your sign-up deadline. 2. Take your Medigap window seriously. That 6-month period at 65 may be your cleanest chance to get supplement coverage with no health questions. 3. Understand the trade-offs before choosing Medicare Advantage. A low premium can be useful, but it may come with networks, authorizations, and limits that matter later. 4. Reshop your plan every fall. Your plan can change even if your health does not. 5. Watch your income 2 years ahead. And if a surcharge appears after your income drops, check whether you can appeal it. 6. Do not assume Medicare covers everything. Long-term care needs a plan of its own. Now step back for a second. These mistakes are not really about retirees being careless. Medicare is a tremendous program in many ways. It covers roughly 69 million Americans. It has helped generations of retirees avoid medical bankruptcy. But it was built in pieces over decades. Part added to part, rule added to rule, exception added to exception. And the result is a system that quietly hands the hardest job to you. You have to know which deadline matters. You have to know which plan changes every year. You have to know which bill is based on income from 2 years ago. You have to know which kind of care is not covered at all. That is a lot to ask from anyone, especially at the exact stage of life when people would rather be done with complicated homework. But here is the good news. You do not have to become a Medicare expert. You really do not. You just have to get a few major decisions right. Enroll at the right time. Understand your Medigap window. Choose your Medicare road carefully. Review your plan every fall. Watch your income before it affects your premiums. Plan separately for long-term care. That is it. Those decisions can quietly protect thousands of dollars that would otherwise slip away. And you do not have to figure it out alone. Every state has free, unbiased Medicare counselors through the SHIP program. They do not sell plans. They do not earn commissions. They are there to help you understand your options. Medicare's own helpline is also available if you need official guidance. 1 hour with the right help at the right time can be worth more than almost any investment decision you make. The maze is real. But once someone hands you the map, the path gets a lot clearer, and the people who avoid the biggest Medicare mistakes are not always the smartest people in the room. They are the ones who know when to stop guessing, check the rules, and make the decision before the door closes.